Hello, this is Dr. Dainik Patel from Australia. Welcome to Oncology Unpack. We grow up believing cancer is something our parents or grandparents face. But here is the brutal truth. In the last 30 years, cancer in people under 50 have surged by nearly 80% worldwide. That means millions of people, young adults with family, careers, dream are facing the diagnosis they never thought possible. But most challenging aspect is that too many are finding out late. Let's unpack what's happening and how you can action. The sharpest increase are in what doctors call early onset cancers. In Australia alone, nearly 20,000 people under the 50 will hear the word you have cancer this year. That's about 11% of all cancers and climbing every year. Bowel cancer doubling in young people, one of the fastest growing worldwide. Breast cancer still the number one in a young woman and still rising. The other cancers include thyroid, kidney, pancreas, stomach and liver cancers are also on slowly steadily increasing. This isn't rare anymore. It's real, it's global, and it's hitting young lives at their most vibrant stage. These are not the cancer of old age anymore. They are reshaping what cancer looks like in a younger generation. And this is what's the main challenge in anyone's clinic. Now, some reasons we know: genes, family history, lifestyle factor like obesity, alcohol, smoking. But here is the unsettling part. Many young people with cancer had none of these risk factors. Scientists are now searching for a new culprits: change in our gut microbiome, ultra-processed food, interaction with pollutants in the environment. But the truth, we don't have the answers yet. That makes one thing very clear, that catching the cancer early matters more than ever. And also participating in the screening, whichever is available through your government program, is also becomes very important as well. Now, here is the most important. Your body's warning are never too young to matters. Firstly, the blood in your stool or a persistent change in your bowel habits need to get checked. If you're turning 50, you can access bowel cancer test free in Australia. In fact, worldwide recommendation to check for the bowel cancer age is lowering to 45 due to rising the cancer cases in below 50. A lump in your neck, on your throat, on your oral cavity could be thyroid cancer or a head and neck cancer. Testicular lump in a young adult could be testicular cancer. Unexplained fatigue, weight loss or a pain doesn't go away, don't brush it off. Now, this will give you the relief that despite all these symptoms I discuss about the cancer, most likely it will be the benign problem and you may advise to get checked by the doctor and may not need any action. But the next thing you could also do to participate in a screening program like bowel cancer screening, which is normally available at 50. There are also some countries which also make it available to have a breast cancer screening, but catching it early and not to ignore the sign is probably more important than just participating or waiting for the screening program. Now, here is the heartbreaking reality. Young people often wait, or worse, they are told by the doctors you are too young for cancers. Some see multiple doctors before anyone takes them seriously. By then, the cancer may have advanced. Therefore, I want to make my medical community aware as well that don't assume the diagnosis without working on it. Age is not protecting anyone. If your body is telling you something, please check it out. Now at last, let's bury this myth once for all. Being young does not make you immune to cancer. So please know your body, respect your symptoms, push for the answers and never ignore the sign. Make sure that you get your appointment with your local doctor and ask for investigation if necessary. Most likely it will be benign, but remember that cancer does not spare anyone. So thanks for watching this video. Please like, share or subscribe.